Well, turning now to an update from our nation's capital, where the issue at the center of the longest government shutdown in U.S. history looks like it will be unresolved by the end of the year, meaning millions of Americans insured under the Affordable Care Act will see a steep rise in health care costs come January. Okay, you may remember the government shutdown ended with Republicans promising a vote on a health care bill regarding the expiring ACA subsidies. Well, 2 votes on that happened today in the Senate, and both of them failed. There was a Democratic bill that would have extended the COVID-era subsidies for 3 years.
This kind of extension of health care subsidies is a very simple, straightforward, non-costly, politically imperative thing to do.
But Senate Republican leadership argued a straight extension is not the right fix.
You can't fix this program. I mean, you can't just do a blanket extension without reforms. It is rife with waste, fraud, and abuse.
The Republican bill up for a vote today said nothing of the subsidies, allowing them to expire, and instead proposed expanding health savings accounts to help people pay for some ACA plans.
The Republican plan is to put the money into the patient's pocketbook so that she has money to pay for the insurance out of pocket.
As you might imagine, that was not popular with Democrats since it allowed the subsidies to expire. There was very little bipartisanship in the votes on both bills. Each needed 60 votes to pass, but both failed with just 51. And it did not take long for the finger pointing to rear its ugly head.
Senate Republicans just shoved the American people off the side of a cliff with no parachute and with an anchor tied to their feet. Now Republicans have all but guaranteed that tens of millions of people will see their premiums double or triple or more next year.
I'd like to see us get past this one stage and then actually work to deliver all Americans affordable health care. But the Democrats are hyper-focused on these bonus subsidies. I worry that the Democrats actually don't want to solve the subsidy expiration. They certainly don't want to solve it for 94% of Americans. They just want a political issue.
The nonpartisan Congressional Budget Office estimates that a lapse in these subsidies, get this, could lead to 2 million more Americans becoming uninsured. Well, just last week, I talked with one woman here in Portland who says she relies on these subsidies. Mac Reed is diabetic and needs insulin. The subsidies dropped the cost of her life-saving drug from about $500 a month to $86 for a 3-month supply. Here's how she described next steps if the subsidies expire at the end of the year.
You know what's going to happen is, like, I'm going to go bankrupt, and then my mom's going to go bankrupt, and then I'm going to die. Like, that's basically that's the, like, sequence of events if I can't afford insurance.